This video will walk you through a series of exercises I use for intrinsic and extrinsic hand strengthening. It uses simple, low-cost items that your patients can find pretty much anywhere. I recommend Amazon. These exercises have worked well for my clients, and I hope they'll help yours as well. First video. This activity works on intrinsic hand strength. It helps to activate the thenar and hypothenar eminences to improve the strength of your palmar arches. This is required for most in-hand manipulation tasks. The directions. With your hand pointed up to the sky, make a bowl-shaped pocket with your hand and place the ball inside it. Squeeze your palm around the ball so that the object is secure. Once secure, turn your palm so that it's facing down to the floor while holding the ball inside the pocket for 5 to 10 seconds before returning your palm to the starting position. Know that the amount of time your patient holds it will depend on their level and ability. The amount of forearm rotation will also change based on your client. Video 2. This activity works on active range of motion and neuromuscular communication of gross digits. It facilitates gross activation and simultaneous motor control of digits 3 through 5. It also requires a sustained isometric contraction in a prismatic pinch grasp of digit 1 and 2. The directions. Hold one ball between your thumb and your index finger using the pads of your fingers. Nothing else should be touching that ball. Secure the other ball with digits 3 through 5. Using movement of all 3 digits, walk the ball down to your wrist and up to the middle part of your finger. Completely stretch your fingers out until they are completely extended. Remember to keep stable and control the ball. This is a hint. Remain in control of the ball the entire time. Do not use momentum, rolling, or gravity to help you with this task. Video 3. This activity facilitates gross activation and isolated or alternating motor control of digits 3 through 5. It also requires a sustained isometric contraction in a prismatic pinch grasp of digits 1 and 2. Directions. Hold one ball between your thumb and your index finger using the pads of your fingers only. Secure the other ball with digits 3 through 5. Alternate the use of each digit. One at a time, begin with your middle finger to walk or roll the ball forward and all the way back so that your finger is fully extended and fully flexed at all joints, all while keeping the ball stable. Repeat this action with the middle, ring, and pinky finger until you have performed this activity with each finger about 10 times. Remember that the number of repetitions will change based on the patient tolerance. Again, remain in control of the ball the entire time. Do not use momentum, rolling, or gravity to help you with this task. Your fingers, your body structures should be in control of the ball the entire time. Video 4. This activity facilitates gross digit activation, fluid mobility, motor control, praxis, in-hand manipulation, and motor inhibition of automatic movements. Secure both items in the center of your hand. Manipulate items in a rotational pattern slowly and methodically so that the items never touch. There should be no sound coming from those structures. Ensure that you are using all 5 digits and the palm or base of your hand during this activity. Do not attempt to go quickly. This activity is about control and endurance. Complete rotational movements for 3 consecutive minutes. Video 5. This activity facilitates thumb to pinky translation and dexterity. It also helps with motor coordination and control. Begin by holding the ball securely between your thumb and index finger using a prismatic pinch grasp. Without touching the ball with the 3rd and 4th digits, Transfer the ball from the thumb and index finger to your pinky. Retrieve the ball and return your pinky to a modified upright position before transferring the ball back to the first and second digit to once again hold it with a prismatic pinch grasp. Complete this about 10 times. And finally, video 6. This activity facilitates co-contractions and stabilization functions of muscles within the extensors and flexor forearm compartments, as well as motor control and intrinsic hand strength. It is essentially recruiting all of the muscles we were working on in former activities within one activity. Remember that this is a challenge. I would highly recommend the therapist doing this activity with the client so that they can be mindful of how challenging it actually is. Place the rubber band around the end of all 5 digits. If you have a large rubber band, simply double wrap the band to ensure that it's providing the right type of resistance. After the rubber band is secure, expand all 5 digits equally, ensuring you are keeping your joints semi-flexed or semi-bent position. Once you have reached the limit of expansion, while keeping joints bent, hold for about 5 seconds. Return to a starting position, rest, and begin again. Do this approximately 5 times. Here's a note. Do not expand further than your weakest digit. For example, if your pinky continues to snap into extension, you are going too far. This exercise is meant to strengthen your digit structures in an open packed position in order to decrease future injuries when performing functional movements.